Well, South Africa, France and the World Health Organization have announced a landmark initiative that will see COVID-19 vaccines manufactured on African soil. The agreement, which was unveiled yesterday, comes after the WHO issued a call for expressions of interest back in April for the establishment of vaccine technology transfer hubs. Now, the BioVac Institute, through its partnership with France, will work with another Cape Town-based biotech company, a network of universities, and the Africa Center for Disease Control. The first vaccines could be manufactured in 9 months to a year's time. Let's get you some reaction to the story now. Rehad Desai joins us now. He is with the People's Vaccine Campaign. Rehad, it's great to talk to you on what is really being hailed as a very good news story for the African continent, for South Africa as well. In the midst of a third wave of infections, you know, many people will be asking, when is an initiative like this going to benefit you and me?
Well, I think it has to be welcomed, but the concern is too little, too late. I think 9 months to a year is overly optimistic. We're rather looking at 18 months to 2 years if everything is done. The government put in the investment as they had promised many years ago, actually. 2016, the AU committed to building vaccine production capacity on the continent, and nothing came of it. The level of pandemic preparedness has been completely shoddy, and we can see that playing out in the short term, particularly in Gauteng, where we don't have enough beds or staff. This is clear that you know, the facilities at Chris Honey Baragwanath Hospital, where we got 400 beds doing nothing, purposely built beds, and we know what the water problems are at Helen Joseph and Rahima Hospital. So we're also hearing about a lack of oxygen, and we wonder whether the lessons have been learnt from the second wave and implemented in any fashion. But certainly good news.
So, I mean, let's deal with that. Have the lessons been learned from the first and second wave of infections? As you say, one does get a sense with an announcement like this that it is sort of trying to paper over the cracks of what has really been a failed vaccine rollout plan in South Africa.
Absolutely. Our hospital systems have failed. Our two-tier system, public and private, haven't come together as they needed to. Our public investment in our hospitals since 1994 has been going down. If you look at the increase, you know, compare it to the increase in the size of the population, our hospitals are not fit for purpose. We need a public health system that is. And in order to contain future epidemics and manage them when they do outbreak, we need a robust health system. The planning is just beyond us. I mean, we know that there's been a big push on registration, but we know there's massive problems with that system. It's only in English. It's not good enough. We're very glad to see that the President has announced walk-ins, but that message doesn't seem to be getting through to everybody. Everybody needs to know that they can walk into a vaccination centre, if they're registered or not, and get a vaccine. It has to be done at people's convenience. We have to ramp up the message why people need vaccinations, and that's absolutely clear. And we need transparency on the supply situation. Why certain vaccines? What are the best vaccines? We now know mix and matching Pfizer with a chimp or adenovirus is very good. J&J or Novavax or AstraZeneca. Why did we send back the 1.5 million AstraZeneca vaccines in the context of shortage? We now know that they work better than 2 shots of Pfizer. So there's lots to be left to be desired when it comes to the vaccination rollout. Many of our provinces aren't working at full capacity, and it needs to change, and change fast, because this third wave will spread to our other provinces. We know we're going to get a fourth wave later in the year, and we're going to get a fifth wave. This is clear. Even if our vaccine campaign actually steps up, the importance of the speed and efficacy of the rollout is critical now, because we know lives, tens of thousands of lives can be saved. By October 1, South Africa, the best international models, when we include excess deaths, is looking at a death toll of over 200,000. By October 1, 2021, we will have lost over 200,000 lives, according to the best modelling that's available. And this is simply not acceptable. It's not acceptable that doctors and nurses are sitting at home without contracts. You know, what are we doing? Why is this? Is this penny pinching? Is this a continuation of austerity politics happening in the midst of a wave? It seems that our people have just been left alone to fend for themselves.
I mean, in light of what you're saying, it's quite devastating to hear our shortfalls outlined in the way you've just done, Rehad. And yet, according to government, you know, the lags in the vaccine rollout plan, going back months now, was out of its hands. They were trying to negotiate contracts that were more suitable to South Africa. They were dealing with a variant of the virus first discovered here in South Africa. I mean, is that a fair assessment to say that many of these issues were out of government's hands? Because that certainly is the narrative that's being pushed.
We've got a number of vaccines that haven't been registered in this country, which have been approved for use internationally all around the world, because our government hadn't signalled its desire to use these approved vaccines. We've got to stop that. We are interested in all approved vaccines.
But Rehad,
Novavax,
can I come in there?
Yeah.
SAPRA is saying that the reason why it hasn't approved those vaccines is because it hasn't received applications from those manufacturers.
It hasn't received application from those manufacturers because it's a long and odious task for these companies. They're not going to do it unless our government signals its desire to use these vaccines. It doesn't cost our government anything to say it's interested in vaccines which have approved efficacy. They're rolling out Moderna in Botswana. Novavax is being rolled out around the world. These are two vaccines which are working against the variants of concern that are out there. Something's going wrong here, and there's no accounting or transparency around this issue of vaccine selection. We don't have enough vaccine sites. How many vaccine sites have been approved? People don't have transport or cars to get to vaccine sites. We need to know when and where are these vaccine sites going to appear. We need to know what the supply situation is. We're told there's more than enough Pfizer stock. We now know that J&J are rolling back in. We know that these Novavax and Moderna would consider supplying South Africa. This is all the evidence out there. It needs to be tracked because government needs to be interrogated. The former Minister of Health, Mkhize, has informed us that it has failed to inform us what's he planning to do about the Eastern Cape province. It's a terrible situation down there in the Eastern Cape, the health department. Other Mpumalanga, Limpopo also need help in the management of their provincial health services. What is the National Department of Health doing about this? The presidency has to step in. We need all of everyone. It's clear that we've got that there's a dysfunction happening when it comes to the multitude of questions that are being posed to government that they're not willing to answer or unable to answer. During the second wave, medical experts informed us that the Gauteng Department of Health could not tell us where capacity was, where beds were, whether they were full or not. The same thing is happening again. There's a complete lack of planning. We're not learning our lessons from South Africa and also internationally.
Yeah, absolutely. Given what you've just said, given the numbers we're seeing around the country, but particularly in Gauteng, outside of ramping up our vaccination program in the coming days, do you reckon lockdown level 5 is what's needed?
We certainly need harsher measures. Now, I don't want to pronounce on, but the question is, when you blame people for being complacent and so on, when we don't have a functional train service, where we have our taxis which commute on a daily basis, 500,000 people in our province alone come in and out of the city in packed taxis, and you're talking people about physical distancing, social distancing in the midst of winter. It's a bit of a joke. Vaccines are critical at this stage, and investing in our public health system, making sure that we have the doctors and nurses that we need and trained, and having all hands on deck to make sure oxygen gets to where it needs to, so the patients that are admitted get what they need, get the care, patient care from staff, and get the high flow nasal oxygen in, is critical to ensure that people's lungs aren't damaged more than need be. When it gets to a certain stage, people's lungs just give in and they die, or they come out of hospital basically severely disabled in terms of their breathing capacity. That these are the very real questions we need to focus on. All gatherings need to be banned. We know we're going into a 5th wave towards the end of the year, and if we continue with this election date, we are looking at a more severe 4th wave, and this cannot be allowed to happen. We've seen internationally that this what happens where elections are called, you get massive spikes.
Yeah, absolutely. Rehad Desai, People's Vaccine Campaign. We're out of time. Thanks so much for coming on to the AM Report this morning. We appreciate it.